This episode is intended for health professionals and provides general advice only. If you are a patient, we strongly advise that you consult your general practitioner or medical specialist for any specific health concerns. Assalamu alaikum and welcome to the Australian Islamic Medical Association podcast. This is podcast number 1. Today's topic is a very important topic and it is also a very timely topic. As the holy month of Ramadan is approaching, there may be some questions as to who should be fasting and who shouldn't be fasting. I think it's also important to go over some basic guidelines in particular at-risk groups during the month of Ramadan, these being diabetic patients and patients with thyroid disorders. To help understand all of this a bit better, we would like to thank Dr. Ahmed Hussain for offering his expertise on this matter. Dr. Ahmed Hussain, Assalamu alaikum and thank you very much for joining us today.
Thank you, Dr. Hamid, for giving me the opportunity to be here with you today. And I think this is an important topic that we would like to talk about.
Thank you, Dr. Hussain. If you don't mind, if I might ask you to just introduce yourself so the audience knows a little bit about you and any special areas of interest that you may have.
My name is Ahmed Hussain. I'm one of the consultant endocrinologists at both Bankstown and Blacktown hospitals and have a special interest in diabetes and thyroid disease.
I'm going to ask the next question, and that question is, what are some general guiding principles that should discourage a patient from fasting?
This is quite an important question, and I think we have to address this issue with our discussions with the patients in the clinic. So all the health professionals, not only the diabetes specialists, should raise this issue earlier in the year when Ramadan is approaching and talking about this to their patients. So it is the responsibility of everyone to raise it with the patient, because most likely the patient will not ask about it unless you are asking specifically about the diabetes management in Ramadan, how they are doing it. So my general rule is actually following the bigger guidelines, which is the IDF DAR guidelines, which is the International Diabetes Foundation guidelines, and has a detailed guidelines talking about the diabetes patients and fasting during Ramadan. And as a general rule, we usually believe that anyone who has labile blood sugar level or a chronic medical conditions or a kidney disease or significant heart disease or specifically type 1 diabetes, especially if it's a poorly controlled with previous history of any recurrent hospital admissions with hypoglycemia or low sugar levels, those are the ones that generally we prefer for them not to fast, and we usually advise them medically that they should not fast.
So I'm just going to follow on with that and ask, is there any specific patient groups or health conditions that would make it inadvisable to fast altogether? So let's say any kind of conditions that would be an absolute contraindication to fasting, if you will.
For absolute contraindication, I would like you to think about it as if it is a traffic light. So usually there is a green, yellow, and red. So for people with a red category or the very high risk category, anyone with type 1 diabetes with a history of severe hypoglycemia in the last 6 months before Ramadan, this is definitely an absolute contraindication, and we strongly recommend for them not to fast, and they must not to fast. And also anyone with a significant kidney disease or they are on dialysis, we usually tell them as well they should not fast. For type 2 diabetes patients on insulin therapy, especially multiple insulin therapy, including the short-acting one, with poorly controlled diabetes or previous history of also recurrent hypoglycemia, they should not fast. The pregnant woman, and this is a quite important category that we have to discuss in more details with the women, because we do understand their feeling, because they are the one actually usually doing the cooking for the family and they would like to share the moment with them. So usually they tend to fast even against our recommendation for them not to fast. So usually we ask pregnant women not to fast. And this is for the sake of their health and for the babies as well. Anyone with a significant heart disease or a recent heart attack in the last 12 months before the Ramadan, they should not fast as well. So those are more like absolute contraindications for fasting during Ramadan.
Okay. Just to clarify on one point, is that any trimester of pregnancy or is it a specific trimester?
We prefer during the whole pregnancy not to fast.
Okay. Thank you for the clarification. Okay, so let's talk about the management of patients with diabetes, in particular, the management of their medications during the month of Ramadan. Is there any specific approach or advice you may have in relation to the management of medications for diabetic patients during the month of Ramadan?
As you know, Dr. Hamid, there are multiple diabetes medications, and each one is behaving differently with the diabetes patients, and especially during fasting as well. We have to put in consideration that there are some medications have higher risk for hypoglycemia or low sugar levels compared to other medication. So we usually classify them as either oral medications or injection therapy. With the oral medications, we have multiple groups. So there are some basic groups like metformin, which is a diformin, or Diabix, comes under different names, but it is the same active ingredient. And usually those medications have low risk for hypoglycemia. So for patients on metformin alone with no other medication, usually they have low risk for hypoglycemia, and we advise them that as long as their diabetes is well controlled, they still can fast with close monitoring. And we usually change their medication to some extent by giving them 2/3 of the metformin dose around the iftar time or the big meal time, and one of the third of the dose could be given around the suhoor meal. However, even if they will end by splitting it 50-50, you still have low risk for hypoglycemia. For other patients on different medication, like other groups of medication, including medication called DPP4 enzyme inhibitors or SGLT2 inhibitors, we tend to reduce the dose to 50% for the SGLT2 inhibitors and keep the same for the DPP4 enzyme inhibitors, for example. And if someone is having history of hypoglycemia during the day, we tend to stop the medication and advise the patient not to fast anymore. There are specific medication like sulfonylurea, which is coming under different names, either diamicron, amaryl, duanil. This group has higher risk of hypoglycemia, and usually when we see the patients before Ramadan, we tend to switch this medication to other medication with low risk, similar to the metformin or the DPP4 enzyme inhibitors. However, we have some selected situation. You are limited with options in terms of the management during Ramadan, especially with the oral therapy, and the patient is still insisted to fast. For those patients, we might use some sulfonylurea only at the meal time and nothing around suhoor time to avoid any hypoglycemia during the day. And specifically for those patients, we ask them to monitor their sugar levels more frequent during the day, and we reassure patients that finger pricking sugar level checking is not breaking their fast. And they should check the sugar level, especially from the time around Asr to the Maghrib time, because this is where the highest risk for hypoglycemia. For the injection therapy, this is more complex discussion that we have to do with the patients. If they are on the injection therapy of the type of medication called GLP-1 analogs, which is not insulin, so this is not insulin, so the risk for hypoglycemia is low. They are fine to fast if they are on this medication without insulin. But if they are on insulin, we have to do a lot of discussion before Ramadan and try to choose for them insulin with low risk for hypoglycemia. So for example, we tend to aim for basal insulin alone without short-acting insulin, or using the short-acting insulin only at the iftar time and avoid it at suhoor time unless if it's highly required. And we also reduce the dose by probably 30 to 50%, depending on which insulin we are using. And with the mixed insulin, it is more challenging because there is always a risk for hypoglycemia, although that fortunately in the last few years, we have other type of mixed insulin, which is having less risk for hypoglycemia. And if we have the opportunity and we saw the patients before Ramadan, we tend to switch them to this insulin if we still have to use some sort of short-acting insulin, which is similar to some insulin called Rysodeg, which has a 70% long-acting and 30% short-acting and can be used around the iftar time because the long-acting component is ultra-long-acting with less risk for hypoglycemia. So for insulin patients specifically, we strongly recommend for them that they have to see their GB or their diabetes specialist few times before Ramadan and work with the dietitian and with their doctor as well to reach the best control before Ramadan. If we have any concern during Ramadan time itself, we change the management plan again according to the situation, because it depends on different factors, not only about fasting and the type of medication, it depends on the type of the physical activities that the patient is doing during Ramadan, and each one is working different jobs. So for people who's having a heavy physical activity during Ramadan, or they're doing a physical job, the situation will be different, and we tend to actually change most of the medication before Ramadan.
Thank you very much. If a diabetic patient is fasting, what are some signs and symptoms during that fasting period that may prompt the doctor to advise that it would be medically beneficial for that patient to stop their fast?
We usually remind the patients again that if they decided not to fast based on a medical recommendation or decision, This is allowed according to the scholar's opinion as well, and this was actually investigated before with our scholars either in Australia or internationally from other organizations where they recommended the same, and there was some fatwa that they should follow the medical recommendation if this is what we think is the best for the patient. So we usually try to reassure the patients that any medical recommendation is actually applicable for them during Ramadan. And if they still insisted to fast, we try to work together to reach the best outcome for them without any hypoglycemia, which is the most important thing. And secondly, to avoid the labile blood sugar levels with the hyperglycemia, because what we can see during Ramadan that risk of hypoglycemia is higher during the day, and the hyperglycemia is higher after iftar and overnight. And the problem with the labile blood sugar level that it is actually well known to increase the risk of heart attacks. So it's very important to ensure that we are achieving a reasonable sugar control, and we avoid tight control during the day as well. So we tell patients that they have to look into specific signs for hypoglycemia, which is usually, as you know, could be tremors of the hand, fogginess, blurring vision, feeling hunger sensation significantly, or they could lose their consciousness, and if it is severe enough, it can cause seizures as well. So the most important thing that during the day, we ask them at least to check the sugar levels 3 to 4 times, and especially from midday until iftar time, they have to do at least 2 to 3 times and watch for any hypoglycemia symptoms during the day. And they have to understand that if there is any hypoglycemia symptoms developed, they have to break the fast immediately. And this is very important. Even if there is still 10 minutes away from iftar time, they have to break their fast. And hopefully Allah subhanahu wa ta'ala will reward them for fasting. But it's very important for us to protect our health. And this is part actually from ibadah or worship for Allah, that you are protecting yourself and the people around you as well. So it's very important for them to remember all the time breaking the fast once they develop any of these hypoglycemia symptoms.
So as the month of Ramadan approaches, it's a very important month for all Muslims, and a lot of Muslims are looking forward to it, and a lot of them are making the intention to fast during that period. Now, some patients may feel very saddened to hear that they've been advised to not fast, or there might be even a sense of guilt among some patients. So as a Muslim doctor, how do you approach this situation where a patient may feel guilty or saddened upon hearing that it would be advisable for them to not fast during this month?
One of the good things about coming from the same background and being a Muslim doctor, and I do understand the culture of Ramadan, that I deal with this in a very sensitive and professional way at the same time, and I show sympathy to the patients, because I do understand that how important for them is to share the moment with the family and get the rewards from fasting itself. So any similar discussion like this from health professional point of view to the patients, we have to understand this very well. And the patients actually, they will feel it. Because if they feel that you are just only recommending from medical point of view, but you don't show some sort of understanding of the culture and the feeling that they are having at that time, unlikely they will follow your recommendations. So you have to engage with them in a professional way and show them you are understanding and you are appreciating this, but you are trying to explain for them from medical point of view that this is very important for their health. And we have clear exemption in Quran, and Allah subhanahu wa ta'ala is telling us if you are sick or marid, you should not fast, and you can compensate this in a different time. And for people with a chronic medical condition, they can pay money for the poor people instead if they cannot actually fast later on. And we usually tell them you can ask your scholars or your sheikh and get some sort of reassurance for them as well, or you can check a trusted websites for fatwa for similar situation. So this will give them some sort of reassurance that you know that this is not only a medical opinion, but this is also supported by the scholars' opinion and Quran and Sunnah, that for sick people, they should avoid fasting as long as there is a medical recommendation asking them not to fast. So it's a quite important part, and thank you for asking this question, because you have to do it in a sensitive and professional way, and you have to show to them that you understand the situation, you appreciate. And I can see from the clinical practice as well, more difficulty you see usually with women, because women, they think that they have to actually share the reward with the family at the time of gathering, because they are actually responsible for the family, responsible for feeding them. and they don't want to miss this. So we usually tell them they are rewarded that you are feeding all those people during Ramadan. Don't push on yourself. Try to follow the recommendation, because if you are keeping your health in a good way, this will be actually reflected on the family as well. So I hope that everyone will stay safe during Ramadan, inshallah.
So I'm going to ask a question now in relation to thyroid disorders. And the first one being is, do thyroid patients experience any specific problems during Ramadan? And number two, can you please shed some light in relation to the management of medication of patients with thyroid disorders during the month of Ramadan?
Yeah. As you know, thyroid disorders usually, if the patients have either underactive thyroid or overactive thyroid. For the underactive thyroid patients, we tell them, especially for the medication administration, it is well known that usually we recommend to the patient to have it first thing in the morning, at least 30 minutes before breakfast, because the food can affect the absorption of the medication by probably 30%. So this could be a problematic for some people, especially people who are missing suhoor, and usually they are asleep overnight and then they wake up fasting and they miss their medication. And by the time they are going to eat iftar meal, they cannot wait for the 30 minutes, so they miss the medication again, or they will have it with the food, and this will affect the absorption. So by the end of Ramadan, they will actually lose almost more than 30% of the dose, and this can affect their energy level, and this can affect the work as well. So it's a little bit vicious circle. So we usually tell the people ahead that if you are going to fast in Ramadan, if you cannot take the medication at least 30 minutes before suhoor, you can actually have them later on at night, 2 or 3 hours after food, and avoid any food for the next 1 or 2 hours again, at least to ensure that you are not missing the tablets. If you cannot do this and you only can actually have them on empty stomach, you can reduce the number of the days as long as you're having it, for example, every alternate days, or you can have a bigger dose 2 to 3 days a week, because we usually calculate the dose based on a weekly total daily dose. So for example, if a patient is taking 50 microgram daily, so over the week is ending up by 350 microgram. This is the total weekly dose for the patient. So as long as you are able to maintain the 350 microgram, it should be fine. So instead of having it 50 every day, you can end up by having it 3 days a week and having 100 microgram for over 3 days a week. So it's very important not to miss the medication and avoid them with the food, and keep the total weekly dose as it is. And if you think there's anything wrong, you have always to go and check with your doctor again and ensure that the thyroid function tests remain within reasonable level, either before Ramadan or in the middle of Ramadan or at the end of Ramadan if required.
Okay.
For the overactive thyroid, it's a little bit different, because it's not only about the medication, it's also about the dehydration, especially if we are going to move at some stage to the longer hours during the day and hot weather, because the dehydration can trigger the palpitation and the tachycardia or racing heartbeats. And this itself could be a problematic for some patients. So we ask them to ensure that they have well hydration overnight and early morning before MSAC or before starting fasting, to avoid any triggering of their overactive thyroid disease.
So I'm just going to shift away from diabetes and thyroid conditions for a second for our last question, and ask more about the generally healthy population, and that population that wishes to watch their weight during that month of Ramadan. So we're talking about weight management. Do you see any pitfalls amongst the general population when it comes to weight management during Ramadan? And is there any strategies that you employ to help patients better address this during this month?
Let's start first by saying that if you watch the media and the newspaper, intermittent fasting now, this is for the general population. Intermittent fasting is promoted actually as one of the new healthy lifestyles. And even non-Muslims patients, they are doing some sort of intermittent fasting at the moment for either general health benefits or because of weight management. So it is more popular now, and it's not only talking about Muslims people. So intermittent fasting, if you are using it in the right way and doing it correctly, you can get a lot of health benefits from them, because this can reduce the inflammation, can actually boost your immune system, and in the same time, you can get benefits from the weight loss. So if someone is aiming for weight loss during Ramadan, as a general rule, you try to keep your calories every day 500 calories less than what you need. So for a general average person, you probably need around 2,000 calories. Probably could be a little bit more for more physical people, but as a general rule, you'll keep it around 1,500 calories every day. This will ensure that by the end of Ramadan, you will lose probably 2 to 3 kilos, which might be very helpful, and use the intermittent fasting from this perspective. Unfortunately, it's very common during Ramadan that a lot of people can gain weight instead of losing weight because of the binge eating usually happening around the iftar time. So even if you are actually fasting for 12 or 14 hours during the day, but there is still the calories wise intake during iftar and overnight and suhoor would be more than you needed during the day. So this is why we recommend for people to use the apps for the calorie counting if they can do, because there are multiple apps like Calorie King or other free apps available, and they can use it for the calorie counting. If they cannot, they have to ensure that they are keeping a balanced diet. And as a general rule as well, if they can have 130 to 140 grams of carbohydrate, this will be generally enough for the healthy young people. We are not here talking about people with chronic kidney disease or people requiring specific nutritional requirements or senior patients. We are talking about healthy young people. They can function well with probably 140 grams of carbohydrate every day, and this should represent about 40 to maximum 50% of the meal during the day. And also for the protein, this should be around 1 gram per kilogram, and this will represent about 30% of their total meal intake during the day. So if someone is not able to do the calorie counting and able to do by grams, or keeping the carbohydrate not exceeding the 40% of the total meal and have a mix with vegetables and protein as well, this will ensure that they are not necessarily gaining weight during Ramadan. And even if they are keeping their weight stable or plateauing, this would be a good outcome by the end of Ramadan, because they still can get the benefits from the fasting itself for boosting the immune system. So weight management during Ramadan is a challenging because of the gathering and functional events, and everyone is offering food. But people who is using it in the right way, they can actually get benefits if they are doing it as we discussed.
Dr. Ahmed Hussein, once again, thank you very much for offering your time and expertise on this very important topic. I'd like to leave it to you for any final words if you may have for our audience.
I just would like to add something, that whatever we discuss today, this is a general guidance, and we always ask patients to seek medical advice from doctors and ensure that they are actually checked before Ramadan, and hopefully, inshallah, to be Ramadan Mubarak for everyone and safe for everyone.
Definitely. Thank you very much again.
Thank you.
Assalamu alaikum.
Alaikum salam.